Today on Health Stories Speak, we have Dr. Alka Gupta, Senior Consultant OB Gynecologist with CK Birla Group of Hospitals in Delhi and Gurgaon. She was VP Delhi Gynae Forum as well, and she is the chairperson for Mukti Project for Cervical Cancer, Haryana OB Gynae, OB and Gynae Society. And she's been working very closely with poorer communities on screening and eradication of cervical cancer. Welcome, Dr. Gupta.
Thank you, Manju, for having me on this forum. My pleasure.
There's another episode on the channel, which is more on global cervical incidence. But I wanted to focus this one on India, because you have a lot of experience with the Indian communities. So my first question to you is whether cervical cancer is preventable. And also, please tell, since you're a doctor, what vaccines are available? Maybe our viewers would like to know that.
Yeah. Yes, cervical cancer is absolutely preventable. This is a disease process which comes through a virus, which is known as the human papilloma virus. It is through sexual contact. Most of us get it with sexual contact, but majority of us are able to fight it out because of our good immune system. But in few, the virus will persist, and then it will cause some degradation of the cells of the cervix, which is the mouth of the uterus. Now, this cancer comes up very slowly. It's a slow-growing cancer. It may take a decade, 2 decades, and there is a precancerous condition also. That is why this cancer is the only cancer in the world for which there is a vaccination. So WHO in 2020 gave a call 90, 70, 90 for eradication of cervical cancer globally. And 90 means primary vaccination for the age group 9 to 14 years. If both males and females,
right.
gender-neutral vaccine. And if you miss the bus, you can go ahead till 26 or even 45 years in some cases. And 70 is screening, 90 is the treatment. There are 3 vaccines available in India. We have a Gardasil 9, which is the state-of-the-art international vaccine. Cost is, of course, near 11,000. Gardasil 4 high-risk strains of the virus, that is around 4,000. And now, for the last 1.5 years, we are also giving the Indian vaccine, Vac, which costs 2,000. The Serum Institute of India. We know they are good. COVID maybe had so many vaccines through them. And so we have this vaccine, which we can give to our patients.
So given that we have the Indian vaccine now, how is the uptake among the middle classes, and what are the reservations with young girls? Because you mentioned 9 to 14, right? That is, they have to have it before they have any sexual intercourse.
Yes. The state of affairs is very sad in our country, in the developing world as such. And 85 to 90% the load is in the developing country. India accounts for 20 to 25% of the global load. We are losing 1 woman every 7 to 8 minutes because of cervical cancer. And cost, like you said, there's lack of awareness.
Yeah.
There is a lot of cultural and social hesitancy or barriers, because rural areas, people think vaccines may lead to infertility, especially something to do with the uterus.
Right.
Harms. In urban areas, it's mainly lack of awareness because it is still not included in the pediatric immunization national program of India.
Right.
So that's why there's a lot of no awareness, ignorance. People don't understand the seriousness of this.
Yeah. So in terms of when you're saying it's not there in the public program, were there any announcements made? Is there an effort to include this in the public programs? Because that seemed like most of the population will be outside this net and they can't afford even a 2,000 rupees vaccine.
Yeah. So, yes, when Serum Institute of India came out, there was big news that most likely it will be taken up by the National Immunization Program, by the government. And in the budget also, there was a mention. A finance minister mentioned it. Sudha Murthy spoke up for it a lot in the parliament, one of the sabhas, Lok Sabhas.
Right.
And after these guys spoke up, yes, there is a movement towards including it. But I suppose Serum Institute of India has just last year come up. They will have to bring down their costs drastically to give it to the government. That equation most likely has not worked out. Also,
Right.
once it comes in the national program, the numbers will have to be massive.
Right.
Because then it will have to be given to every child who is born. And
so the availability of the vaccine, you are saying, will have to be much more to be covered in the public program.
Which will come up with time. But I suppose these things take. But there is a good movement. We are happy with that.
That's good. So what about, that was the vaccine part and the prevention part. What about the screening? What are the tools for screening if people have gone beyond that age? How do you make sure that you are screened for it? And if unfortunately you have it, what's the treatment? So you can take it up one by one, maybe talk about the screening first.
So screening means we are doing preventive tests in asymptomatic public. They are not symptomatic. We are trying to pick it up before the disease process comes up or when it is in the pre-cancerous stage. Right. In the urban areas or globally, there are two screening tests. One is the virus itself, HPV virus. God has given us a natural man-made passage, the vagina, in which as a gynecologist, I can easily introduce a speculum, the instrument, and I can visualize the cervix directly. I just put in a brush and take a sample by rotating it around the cervical canal. When I bring it out, I can do the HPV virus. I can do the what is known as pap smear. Right. These two tests together every 5 years from 30 years onward till 65 years age have to be done. Right. The screening uptake is very poor, 4% of the population. But these tests cost. They will cost about 3,000 to 4,000 per person. Right. So the WHO had come up with a simpler screening procedure, which is known as VIA, visual inspection with acetic acid, where I take the simple household vinegar, 5% dilution, put it on the cervix, it creates an aceto-white area wherever there is a precancerous or cancerous lesion. Right. And that is my point of referring the patient or taking the patient up for further management. Right. This is a ₹1 test. And in the low resource areas of the world, Sub-Saharan Africa, Central America, Southeast Asia, South Asia, our country, this is the test which has to go village to village at all the public health centers. I work with this community, the Laksh Foundation NGO. We have screened 500 ladies in the last 2 years. We have done 28 camps. And we have picked up 12 lesions. Right. 10 of them we have been able to follow up and get them actual treatment. It may be a drop in the ocean, but the drop is there and many others.
No, this is very, I think it's a very exciting and very, very useful work that you are doing, working with the poorer communities. But just one question, Doctor, since this is done with vinegar, every normal person, even me, might feel this test is not so effective.
Really as good as a pap smear. There may be a little more false positives, but that is the idea of screening.
Right.
Instead of missing the disease and bringing about morbidity and mortality, pick up more, then do the pap smear and the biopsies and see if the disease process. Yeah. There's no harm in that. And the advantage which WHO has worked out is that this has to be done only twice in a lifetime. Even if we do it once at 35 years, once at 45 years, we will eradicate it by 2035. 90, 70, 90. And the second part of your question, where you talk about treatment.
Treatment,
Yes, all those who are detected, there is state-of-the-art treatment in India also. Even our government hospitals are totally equipped. Private setup is there. We used to have a cervical cancer ward in 1978 at Lady Hardinge Medical College when it used to be chock-a-block full because of multiple pregnancies and all. There used to be so much cervical cancer.
Right.
Now that ward I hear is not that busy, but the treatments are there. Surgery, radiation plays a big part in this management and all of that.
And for this, the specialist to go to for treatment will be the oncologist, or it's a combination of the gynecologist and oncologist?
Yeah, so over the since 3 decades back, 4 decades back, when I was studying, we were the people. There were no
Right.
oncologists trained
Right,
on.
right.
Lately, over the last decade, or you can say 15 years, 20 years, more gynae oncologists have come. So now, if I get such a case, I will do it with the gynae.
Gynecologist. Okay.
I will bring the gynae oncologist on board.
Yeah. No, all this is very useful information. On my last question is about how do we achieve 90, 70, 90 that you mentioned? What do you think are the main, one of the points that you mentioned is about the government picking it up. So what can be done in addition to the independent efforts like you are making and maybe some others are doing? What really needs to be done?
So it has to be picked up at the national state level. It has to be picked up. The countries which have done that, Australia is near to eradication. I think next year we are hearing of an eradication. UK is next in line. UK will also show, while other countries are behind.
Right.
In India, again, it has to be, the government has to take up, create awareness with social medias, right? With print media, social medias, and they have to bring it up on their national program in the National Pediatric Immunization Vaccination Program. That is the only way. And in fact, even though India still gives 2 doses between 9 and 15 years, but WHO has now stated, and Australia is following that. They say we'll give 1 dose, it gives 90-95% protection, and we will give it to more, to everybody. They are giving it to every girl or boy between that age. So even single dose gives major protection, and we achieve in numbers the benefit.
That sounds really good. And in terms of the media coverage that you're saying, just one thought comes to mind. I'm not sure whether Amitabh Bachchan would do it, but we need somebody like Amitabh Bachchan, like he speaks about polio. I think he needs to speak about cervical cancer.
The way the polio campaign has come up.
Yeah.
Similarly, and I'm sure once the government takes it up as a national immunization program, they will bring in the awareness also.
And of course, in addition, the Serum Institute has to increase the availability of the vaccine.
Or maybe somebody else will also start producing. They will have to give the right to somebody else once the government comes into the scene. So we are hoping that in an year or two, we see this thing coming up.
So last question, very briefly, do you want to mention a little about the communities that you go to? How do you approach the girls and how do you convince them? So very briefly, I know you're very passionate about it.
I'm very passionate. So there is this Lux Foundation, which runs an education vertical where these young girls who have just passed out of school, don't want to get married, they want to study more. So they get their stipend by taking tuitions of the junior students. Right. Now, these are my volunteers. I have created awareness with workshops. We have done 13 workshops in the last 2 years. I have created awareness by teaching them what is cancer, what is cervix, what is prevention. They go house to house. Earlier, their mom came, their aunt came, their next door neighbor came. Now the ladies come to them. We are covering 8 villages now. And they will say, "Hame na doctor ke paas le jao. Take us to the doctor, and get us." These girls are doing such a good job. The ladies don't hesitate in coming and lying down on the examination couch and getting examined by
This is very positive. And I think on a and sorry, do you have something else?
I just had to, and now these girls who hesitated taking vaccines initially have convinced their parents. We at every camp lately we have started giving 6-7 vaccines also, Cervavac, the Indian vaccine, and they are accepting. And the next camp, I have a list of 10 girls ready again.
Oh, excellent. This is excellent work. On an ending note, I want to say, Doctor, I think you and I should try and approach Mr. Amitabh Bachchan to take up on a social cause. Yeah. Thank you so much for giving us this very useful information, and more power to your work.
Thank you.
Thank you so much.
Thank you. My pleasure.